All right, thank you everyone for joining. We're going to give it a second to let everyone enter the Zoom room, and we'll get started here in a moment. So appreciate it.
Andrew, how's Kranzberg going? You guys have so many different iterations.
It's going very well. We started our reopening and have had some decent success in terms of attendance and really putting our safety plans to the test and feeling very comfortable about that.
Good.
Okay, everyone. Welcome to the Missouri ArtSafe Public Relations webinar. My name is Andrew Warschauer. I'm the Director of Marketing and Communications at the Kranzberg Arts Foundation. Today's webinar is presented by the Missouri Arts Safety Alliance, collaboration of over 20 organizations in Missouri. The webinar is presented with platform support from ArtsKC and the Kranzberg Arts Foundation. So first, I wanted to provide you with an update on Missouri ArtSafe. We currently have 44 organizations that have been Missouri ArtSafe certified. To view a full list and for more information on how your organization can become certified, please visit MissouriArtSafe.org. Now, a few housekeeping notes before we get started. This webinar will be recorded and transcribed and will be sent to you via email. It'll also be archived at MissouriArtSafe.org to watch and share. We ask that all questions are placed in the Q&A section, not the chat, at the bottom of your screen, and we'll leave time at the end to answer your questions. Also, at the end of the webinar, you'll be prompted to answer a survey. It should only take you a few minutes and will help us plan future webinars, so please take the time to fill it out. With that said, let me introduce you to our panel. Kwofe Coleman began his Muny career in 1998 as an usher and has served as managing director since 2018. Coleman has held several other positions at the Muny, including staff accountant, house manager, digital communications manager, and director of marketing. In the director of marketing and communications position, Coleman directed the team responsible for all external communications, marketing campaigns, and the development of strategies to meet the Muny's annual revenue budget. Among his duties as the managing director, Coleman oversees the organizational, financial, and business affairs of the Muny, while embracing and articulating the artistic and institutional vision. This includes the development of annual budgets, determining income and expenses assumptions, and overseeing those revenues and expenditures. In this position, he also takes a leadership role in developing new and expanded income streams and creating strategic initiatives to expand and deepen the Muny's commitment, community engagement, educational, and outreach efforts. He was a 2018 fellowship advisor for the DeVos Institute of Arts Management, the University of Maryland, and is the vice president of the board of directors for the National Alliance of Musical Theaters. He has also remained an active contributor to the St. Louis community, with local activities including the advisory board for Common Circles, advisory council for Core Jesu Academy, founding board for Atlas School, and is a mentor for the Urban League's Save Our Sons programs and other social service organizations. He is the recipient of the St. Louis American Salute to Young Leaders Award and the 2019 St. Louis Business Journal's 40 Under 40. Thank you, Kwofe, for joining us.
Thanks for having me.
Next, we have Abby Cradford, the Director of Education at COCA. Before joining COCA in 2016, Abby worked as a classroom teacher, program manager, and the designer of teacher preparation and learning experiences in St. Louis, Phoenix, Los Angeles, and Houston. Most recently, she worked with Teach for America, St. Louis, including a regional training institute for all incoming St. Louis Corps members. Abby holds a BA in Political Science and Communication Studies from Texas Christian University and an MAT from Webster University. Abby, thank you so much for being here.
For sure, thank you.
Finally, as Director of External Affairs at the Contemporary Art Museum, St. Louis, Unitey Kull is responsible for marketing, communications, and visitor services, seeking to grow CAM's audience and reputation locally, nationally, and internationally. She also oversees the museum's earned revenue operations, retail, cafe, bar, and facility rentals. Prior to joining CAM in 2011, Unity was the executive director of the Manhattan New Music Project in New York City, where she led the organization to receive a 5-year, $4.6 million federal innovation grant. In addition to consulting for a variety of nonprofits, her background includes managing cultural grant programs for the City of Chicago's Department of Cultural Affairs. Unity holds an MBA in Strategic Management and Public Policy from the George Washington University and a BA in Visual Arts from the University of Maryland, Baltimore County. Unity, thank you so much for being here.
Thank you.
So to get started, I'd really love to hear from each of you about how you handled the rapid influx of information over the past few months and what you thought were successes in your communication and any pitfalls we could learn from as a community. So Abby, would you mind starting it off?
I was fearful you were going to ask me first. You know, for us, we're really fortunate at COCA to have an operations team that focuses on the way our facility runs and the way that we welcome folks into our studio spaces, even in non-COVID times, right? And so during this particular moment in time, that team has served a very different function in making sure that we're sifting through all of the information that's available and ever changing, and that we chose internally to take the most conservative interpretation of the information out there. Because I think others can probably relate that very little of the policies and procedures that were recommended locally and nationally were like, hey, museum, do this, or hey, arts studio, do this, right? And so we had to really make a lot of very calculated inferences, choose a really conservative approach. And then our third piece is that we've been really consistent with it. So we piloted a set of procedures this summer at a very small scale, and we have maintained those procedures into the fall. Even in some cases when we probably could have loosened a little bit, we have stayed really consistent, because when you're working with children primarily, that consistency is really, really important. I don't know if that's helpful, but that's how we approached it. And then every day we find things out. We're like, oh, that's new information. We'll add that to what we know.
Thank you. Unity, do you mind running us through what CAM has done?
Sure. So in the beginning, it kind of felt like all of a sudden we were trying to be health experts, you know, working in a museum. It's like so much information, and we are about 18 full-time, and then we have a number of part-time. So while we have a decent amount of structure, we don't have a dedicated team that would deal with something like this. So we actually put together what we called our interdepartmental task force, and that was super helpful. We had a number of meetings. We were just trying to consume as much information as possible, and we would meet departmentally and as senior staff and within departments, and just trying to learn from other institutions. And, you know, at one point, I think in our plan, we were talking about the R naught, and we were like, we don't even understand what that means. Like, why? We're not the health experts. So we decided that we would really like pay attention to what the city is saying, what the mayor's office is saying. And ultimately we put together a plan. We got a lot of comments and suggestions and questions from the rest of the staff, and then presented it to the board, got it ratified, went through the city office, got it approved. And, you know, in the meantime, our curatorial staff was trying to figure out what we were going to do with the exhibitions on view, because they were scheduled to come down in April. And, you know, it's dealing with all the lenders and this special rigging equipment company. And ultimately, we were able to get approval for the exhibitions to stay up through August. And really, I think we felt like, I think we had our plan mid to the end of June. And by then, it was about training and really making sure that our frontline staff felt comfortable. We had to build the ticketing side of our website. So it was just a lot of new at once. But generally we've felt pretty good about it. These exhibitions came down in August. We had a moment to really like reset and reflect. And then we had to develop, what does an opening look like? CAM usually gets like 1,000 people in an evening for an opening. So we decided we would have an opening that went from noon to 8 p.m. and how would the tickets work? And so it's, you know, it's all been a work in progress, but I feel like we've, you know, we feel good about, and I feel like all of our staff feel comfortable with the approach that we've taken.
Thank you. Now, Kwofe, what's been going on with the Muny?
Well, I think Abby and Unity made a number of really very valid and true points about looking at what the experts in the fields were saying. You know, at the beginning, there was such an influx, like you said, of information that trying to discern what's true, what's not, what makes sense, it can be overwhelming. So, you know, we stuck with health experts, we stuck with science internally. Similarly, we also took our team and subdivided it into areas so that everyone wasn't trying to absorb everything. So there were a group that worked together, identifying if we were to open, how much PPE would we need and what are those items or what are most effective. There was a different team that was talking about what, you know, working with our front of house team as to how would the entrance and exit procedures work. A different team was looking at our relationships with some of the other unions and trades that we work with to see the feasibility. And then those groups in a representative way worked together every regularly. It started off every week, then it was every couple of days, and it felt like every 5 minutes. And that was the reality of it. But I think what helped us internally the most was not feeling like any one person or any one group had to know everything. And that made a good difference for us internally. Externally, transparency, I think, was the most effective thing that we could do. We differently, that knowing that we would either have an opening day or not an opening day, and that meant there was a season or not a season. We basically had two options for a regular season or an extended season, and we told the public well in advance, you know, the day that we'd have to make that decision by, and that it would be one of two things, so that when we did speak externally, there was a trust in knowing that, look, these are the two options. We're telling you what we're deciding between, and you're seeing the same news, you're seeing the same information that we're seeing. Whenever we spoke in between then, I think it was always helpful, both internally and externally, to give the backup or the support for what these certain decisions are. If we were talking about thresholds of how many people could gather for the office, then we gave them the background of where that came from, so people could feel empowered a little bit to research on their own and understand where those choices were coming from. When we talk about pitfalls, I think that we probably all run into this question of that you hope that you can explain it well enough that everyone will understand and accept the seriousness or the gravity of what we were dealing with. The truth of the matter is, it doesn't, you know, everyone exists on a sliding scale of belief or acceptance or whatever you want to call it of what the health landscape was. So at some point you just have to say we're making the best choice based on the facts we have, with respect to everyone else's opinion, but knowing that, you know, we have to make that decision based on the community. So I think we'll get to negative feedback a little bit lower in the agenda, but learning to absorb that and move on was new in this sense.
And it's certainly tough calls as the information was evolving throughout the whole process. So not easy work that I know we all have to deal with. Yeah. My kind of follow-up is then, as part of Missouri ArtSafe, we're asking that organizations publish their safety plans. So I'm curious how you all are communicating your plans and policies to guests and to the public.
I can answer pretty easily because we Perfect. Don't have guests right now. So we're seasonal, so we don't have anything to communicate. I mean, when we do, it by all means possible, electronic, you know, we'll email, we'll print, everything will be online. We'll use partnerships like these to put that information out. And I think these partnerships are helpful because as we approach the fall, the winter, and next summer, when hopefully more things are open, we're all going to need to be megaphones for each other. So I think that you know, these things will help. But I own that we have it a little bit easier at the moment because we're not even supposed to be open anyway.
Yeah. Yeah, for us, we started our fall semester the Tuesday after Labor Day, so September 8th. But like I said earlier, we just very 2-day a week, low scale, 5-week kind of semester, mini mester this summer. And so all of the information, all of our policies and procedures are on our website. When families register, they also sign a commitment form that they're going to uphold the, entrance screening policies and procedures, et cetera. We have trained all of our teaching artists in COVID modifications, and we also opened a new facility during the pandemic. And so part of that, which don't recommend that, but if we did it. And so part of that training also included physical scheduled tours with our teaching artists so that they were really comfortable in the new spaces, and that wasn't an additional barrier to like their success in the studio. And then we have maintained, obviously, a running set of procedures and policies on our website, including most recently updates to include exactly what families should do, or we ask families to do if and when they become exposed and need to opt out of classes for a set amount of time. One of the biggest shifts we've made in our model is that families are now dropping students off at the door versus coming into the building with them. That has been a huge shift for us. We have never in our history done that before. So we also have more staff available to kind of be the parents in the hallways, if you will, and be supportive of kids. But what that has done is that has also set us up to know very accurately who is in the building. So if and when there is an exposure, we're able to communicate with those folks directly. It has also meant that we have limited our classes and experiences to older students. So we're not doing anything with kids that are under 6, because of course one of the things that the county health department, and I'll share this because I think it was so helpful for me. One of the things the county health department shared with us when we were writing our plan for approval, and we sit in the county by about 3/4 of a mile, and so that's who approves our reopening. And they said, don't make a procedure or policy that is bad for kids but good for COVID. So for example, don't have a situation where like an adult is not allowed to get out of their car to help a kid with a seatbelt when really that needs to happen, right? And so we just need to ask them to have their masks on, etc. And as a parent and as an educator, that feedback from the county was so helpful because it helped me think about the whole kid, the whole team, and then how do we communicate that to families, right? Because they're trusting us with their children and they're not even in the building to supervise what's happening. And so that communication with families has been really central to our work to this point, and quite frankly, just ongoing. Obviously, answering individual families' questions. If there are changes to our policy, we are texting families. As we know, folks right now are just inundated with email and that sort of thing. And we're just making sure that we're to Kwofe's point, as transparent as humanly possible.
So we did the usual things, had to figure out where this information would live on our website. We had to, figure out a ticketing system because as a free museum, we don't have tickets. But as part of that, we were able to build a system that lays it right out when you make your free reservation. Here's what to expect. You have to wear a mask and practice social distancing. Don't come in if you're sick, et cetera, et cetera. Please let us know if you need to cancel. And then we have a reminder that goes out right before. And then with that, we also have information for contact tracing. We did decide that we wanted to be able to allow walk-ins based on availability, and which is, we try to be really accessible. So we think a lot about signage. We've got a sign outside that basically says that, walk in, and we do get, God, we get about 40% walk-in, which is kind of fascinating.
Mm.
We've got the sign on the door. We have the big sign. Once you like walk into the space, here are all the things. And something we stole from a museum in Milwaukee was be kind to each other. Like this is, you know, the human aspect. You know, obviously with social, et cetera, once we figured out the date, I think we reopened on July 9th. So late June, we put out the press release. Thankfully that got picked up a little bit. And then we looked at what, you know, PR partnerships, social partnerships we could do. So, you know, Curbside STL, Explore St. Louis, STL, St. Louis Graham, like just thinking about how could we get out the word a little bit more. We haven't quite gone to influencer marketing, but it's something that we've contemplated, the whole like wearing a mask in a museum. This is how I'm visiting. And frankly, like people have been coming. We have significantly limited our capacity based on, you know, we said, well, if people need to be 6 feet apart, you know, it's not even about the percentage of the venue, but we have all these gallery spaces. How are we going to do that? So we decided we actually only have one ticket every 15 minutes, which allows us to have availability for walk-ins. And yeah, that I think from the public standpoint, it's been working well on with our school communities. It's been a whole another, you know, we have curbside pickup for art supplies. We've been dealing with Zoom. I think there's been a lot of like one-to-one communication. We're still talking to our education partners. Yeah, all the things.
All the things. Yeah.
That's super helpful and leads me into kind of my next question is, we're talking about guests a lot, but also we do know that there are a number of constituents and people who attend our programs that aren't guests strictly. They're educators, they're staff, and they're partners. What strategies have you all developed to stay in touch with that kind of category of people? And what have you found to be successful?
Right now, we have done all of our professional development and workshops. So part of my department is responsible for stewarding all of our community partnerships and all of our school-based partnerships. And we have used virtual platforms, primarily Zoom, to still engage in the planning, in the professional development that we would typically do, in the collaboration that we would typically do. We do have virtual after-school programs happening with several community partners. We have some virtual camps that were happening through St. Louis Public Library, et cetera. And we also are just in really heavy responsive mode, right? I'm a public school parent. My girls both attend school in St. Louis Public Schools. And so I see the realities of our partners from a lot of vantage points. And the reality, I believe, is that our schools are navigating just a torrential downpour of variables that I feel really privileged that my variables are very different in my work, right? And so we've taken the approach of care and maintaining relationships. And I've also really reinforced with my team the concept and the mindset of hibernation versus cancellation. So I'm not saying that like bears hibernate, but like they wake up, right? Like they're not in the hole for the rest of their lives. I would hope. I think that they wake up. That's what I was taught. And so that's our approach with our partners right now, is we're really remaining as flexible as possible and saying to them, you know, if you need to hibernate for this period of time, we want to support you in that. And when you're ready to reignite, we're ready to do that. That also means for us that that's language we have to use and are responsible to use with any of our stewards and funding partners as well. And I think what is remarkably apparent and also very helpful about the pandemic is that there is no one that I know of that this has not touched. And so if I'm calling up a financial partner, if I'm calling up a school partner, like everyone's in the same boat. And so it's not a shock, right? If we have to hibernate this partnership, or this is not going to happen in the way that we originally planned, no one is shocked by that. And that's really great, because it means that we can continue the work in a different format, or we can continue the work at a later date.
Abby, again, touched on a number of important points. I think for us, to create a season or create a show, there are a number of different disciplines, trades that come together. They're represented by, true and simply put, by different labor unions and different groups. So what we found when we were preparing for the possibility of a season last year, and as we start to prepare now, is each of these groups have a different set of criteria or needs to deem the environment or what they do to feel safe. And the truth is, often they don't necessarily overlap too much or to this extent in other places. So what we found is that we were become a little bit of a clearinghouse of different criteria that everybody wants, and see how can we marry those concepts to work in a theater or in an environment. Ours being a little bit unique with the outdoor aspect. It's different how they have to work together here than a lot of other places, but the sharing of best practices amongst different groups that, when a pandemic hits, that communication amongst these groups falls apart. It's not the top priority. Employment and safety is. So figuring out ways for these groups to work together. It has been that was the difference for us. The truth is, we can't do it without any one of them. So it's not like we can plug and play and replace. So it's truth in our behooves us to make sure that we can find some of that synergy, and we found that sharing that information is also has been helpful to some extent. Again, we had to make an early choice that was in the summer, and then that was it, and then we're essentially 9 months removed. So we continue to look at how the landscape changes, but there are no decisions for us to make in October that we think will be relevant come June, and that's so we keep looking, and when we stay kind of stay the course, hopeful and optimistic, but still prepare for a couple of those eventualities.
I completely agree with what Abby said. This is happening to everyone. We remind ourselves as a staff sometimes that this is and what you were saying, Kwofe, that we're lucky we have jobs, we're healthy. What's the bigger picture? And the way that we've approached partners is really collaboratively, case by case. I know that our learning and engagement team just did a really great hybrid on-site, online connection with their teaching artists for training. And I think for every community group that we're working with, it could be hibernating, it could be, coming up with a new program together, working on a Zoom program together. It's sort of, everyone's in it together, which is nice.
It is nice to know that none of us are alone in having to face these challenges. One of the biggest challenges that might come up for organizations is having a COVID positive case. I'm curious if you all have a plan in place, or how you might approach if someone on staff, if an artist, if a performer, an educator has a case, how you might address that with the public.
Well, I'll go first, just because we had a little bit of a scare this summer, and it was a little crazy. So the last weekend of our spring summer exhibitions, we were fully booked online. Everybody waits till the last weekend to come in and see the shows. And then one of our visitor service associates, one of our frontline staff, threw up in the bathroom. And this was at probably 1 p.m. And, nausea, vomiting is one of a long list of COVID symptoms, but it's not a core. It's not like a fever. But so immediately the visitor services manager calls me and we talk, and she says, everybody, staff, we would feel comfortable if we closed for the rest of the afternoon. And we got the executive director in on it immediately. And, we decided, out of an abundance of caution, fine, we're going to close. And I have to admit, it's a little hard to close when you have a lot of people that want to see the shows and you're getting a lot of good PR from. But so we're lucky that with our reservation system, as I said, and this I'm sure is true for everybody's reservation system, but we have contact info. So we had somebody that's just like calling all the people and telling them we're going to try to fit you in tomorrow. And our plan basically was we had enough staff, and we were able to like call around and figure it out that none of the staff that were on site could come in the next day, that we could have a fresh start. We would do the extra cleaning, but we decided that it would be okay. And then, you know, immediately the woman that wasn't feeling well would go get a COVID test. And so she was sort of the idea of patient zero. And then if something happened, we would communicate that out. But ultimately it was from a migraine. She was fine. But we put it out on Twitter and Instagram and put sign on the building. And it was hard, but I think people really understand right now. And, you know, they kind of expect it. Like when we were coming up with the language, we were shy to use the word COVID, and honestly, it felt like probably wasn't COVID. So we just said, you know, out of an abundance of caution, CAM is closing for the remainder of the day. It was a little hard because in the next day, we just had a lot of people coming in and we had to turn some people away. But I think, you know, I feel like we prioritize our staff, and obviously if something happened, or visitor, or teacher, whomever, we're going to do that over, you know, staying open. And I feel like we're nimble enough, we're small enough, we've got our cell phones, we can just make the call and then communicate it out.
For us, you know, as I shared earlier, because children are entering studio spaces, and with teaching artists, there's a lot of risk mitigators that we have in place. We screen at the door, the temperature check, the questions, everyone is in masks at all times. Every child or student, I should say, has 100 square feet taped off that is their space in which to move. Every studio, we have these like Ghostbuster guns. That's what I call them, right? They look like they're the coolest. I want one for my house so bad. Y'all don't even know. Okay. If one goes missing, you'll know where it went. But we sanitize every studio between every class. All of the stereo equipment and that sort of stuff is wiped down. All of our vocal music classes are all virtual. Our art and design are primarily virtual with individual tools, all those things, right? And so I name all of those because those were very intentional risk mitigators. And so what that means for us, and we use some decision flow charts that are out there. There's one from WashU Pediatrics that was just published a few weeks ago, actually, that's really was designed for schools, but is very helpful in this context, about just sort of like layers of risk mitigators that help reduce the risk of exposure, right? And so if and when there is a positive case, when someone was like, oh, I was in this class on this day and now I have COVID, we contact everyone. And this has happened one time, so let's be honest, right? We contact everybody in that class. We obviously make sure that they have access to all of our virtual offerings. And so our classes are live stream capable. They're Zoom capable when necessary. And then over the summer, we also used some downtime because our teaching artists had some downtime because we were not doing as many classes, right? And we had all of our artists pre-record several lessons in alignment with their curriculum that we now have as a catalog of resources. And so we're able to then let the families know that we're, you know, in that class. This is what happened. Here's the day that it happened. And sort of here's your menu of options. Here's your path for the next 2 weeks, right? And that has worked. We always come back to our screening questions because our first question asks, you know, if you've been exposed to someone with COVID in the last 2 weeks. And so we get asked a lot by families. I do what's called like the COVID Sudoku on the phone with moms, right? They call and they're like, you know, 2 weeks ago, our soccer coach's cousin thinks they might have had COVID and we were at the park. Should we come to COCA, right? And the question that I always come back to is the first question on our screening, which is, were you in contact with someone with COVID, right? If you can answer that question, then you can come in the building. If you can't answer that question, then you should not come in the building. And that's why we have these virtual options available for people. And so to Unitey's point, we just tried to be as transparent as possible with families, and making sure that they know, while also anticipating this would happen and being prepared with resources to supplement so that kids are able to continue their educational experience, their training, and their learning, regardless of what's going on, whether they're exposed, you know, at school, on a sports team, at the grocery store, like wherever. Those exposures are bound to happen because it's a pandemic, right? So that's how we've approached it so far.
Yeah, fortunately, we haven't had, from an audience perspective, right, we're not in a position where we had to make that choice. But even from a staff perspective, when we were debating whether or not to bring the staff back, or as we were creating our virtual online season, there were some people on site, and we, you know, for us, the number one question was speed. You know, as we know, the faster everyone that's possibly in contact with anyone knows, the most, it's about mitigating that exposure as much as possible. So, you know, for a small example is we had a staff person when we were doing our virtual show whose job was to simply walk around and make sure everybody was following the 6-foot rule, hand sanitizer was refilled, people were washing their hands, you know. So you invest in resources in purely mitigating the risk as much as possible. You know, the city and even on a national and a local level, there are guidelines for large venues and large crowds. If and you know, when we open back up at full tilt, you're looking at 11,000 people in one space, which at this moment sounds like a crazy thing or a crazy number to say, but we follow all those guidelines, you know, and I think this was said earlier. I think Abby said this earlier. You take the most conservative approach possible. You know, we're not going to find ourselves in a position where we're saying, hey, this is maybe okay. If it even smells like it's sort of not okay, but that's the way we're going to go. It's, you know, we're never going to make the choice of profit over people. That's just not what we're going to do. So we look at it as what's the safest, fastest way to get the information out while still protecting people's, you know, their privacy. Like I said, it's not something we've had to face yet, but to Abby's point, it's something that we most certainly will. I mentioned earlier that we have these different unions and groups that have representation, and each of them also come with a protocol that must happen, whether you're a performer or musician, of what must happen if someone that comes in contact with that group tests positive, or even has the possibility of testing positive. So, you know, we follow those, and it makes it tricky from a human resources and management standpoint, because everyone has different rules. But like we were saying earlier, you try to find the best practice and you follow them. You know, we keep saying it's a refrain. We're all going through this at the same time. So it's confusing for all of us, and that whatever level of patience that that people have with each other helps.
And I just want to quickly add that we are doing everything we can to make sure that we have all of the contact information for anyone that's in our building. We do a health screening for, you know, for staff, for visitors. We just ask them to sort of self-select on our website, but anybody that's working, so that, yeah, as soon as you find out that something's happened, you're at the ready.
Can I actually, oh, Andrew, I'm going to go rogue for a second. There was a question in the chat that I think is related to our conversation. And it was from Sarah Holt. She asked about sort of backing off a previous safety measure based on new data, and how you handle that, and the specific thing around like surface stuff versus and temperature, right? That we know. I mean, my dad has COVID right now. He has no symptoms, right? So like, I get all of that. Is it okay if I respond to that question real quick? This is like improv. Andrew, are you ready for this? Okay.
We're leaders. We're all good with improv.
Okay, good. I think that is such a great question. And one of the things that I think is a constant part of our conversations, especially with families, is that no single risk mitigator by itself is sufficient. And so, for example, if if our primary risk mitigator at COCA was masks and that was all we were doing, that is insufficient. If it was just, you know, doing the studios with the Ghostbuster gun, that is insufficient. And so we have chosen to continue to what Kwofe just reiterated, to continue to interpret the most conservative version. I will say, with one exception, which is we have noticed in our studios, there are classes where they do not do any floor work, and there are classes where they do much more floor work. We noticed that in our pilot this summer, and so we have differentiated the products and the way that we're cleaning those studios based on the specific classes, versus this summer we were handling every single class the same as we were piloting. But I do think that is just something that's just been our approach. I would imagine that if I were in a situation where I was maybe not seeing the same kids every couple of days for an entire semester, if I was doing more special events or kind of one-off things, that each time I rolled out an event, that the procedures might be different based on the current research. For us, because we see kids for 15 weeks at a time, because they are in the building without grown-ups, and because they are not adults, they are children, that consistency piece is just absolutely critical. And so that's what we've chosen to do. I don't know if that is helpful or if that resonates with other people, but I really think the context of your organization and the types of arts experiences that you're creating for people really drives kind of the speed of change with some of those procedures, just because the end user in our case is a child, and for you it might be someone that could more fluently kind of navigate those shifts. There was another quick question too, directly to COCA, but we don't have to, I don't want to derail you totally, so I'm just going to stop talking now. So.
No, that's totally fine. I did just want to see if Unity or Kwofe, if either of you had kind of anything to say about backing off of policies. And if that's
we have one
changed
tiny example. When we reopened, we had people, you had to wear a pair of gloves in the shop, and we had the whole, like, we have a tiny little shop, and you had to like ask at the front desk, and then the front desk person would put on their gloves to give you a glove. And frankly, like, nobody's going to want to browse if they have to take that extra step. But then after this research is coming out, we're all like in our communities going out and about and going to the little, and we're like, you know what? Hand sanitizer is okay.
Yeah.
So now we ask people to hand sanitize, and I'll tell you, those shop sales have gone up. It's been great. Like, and we still limit, you know, you can only be one person in the shop at a time, but it does feel like that was a little extreme. We'll be okay.
Yeah. Well, it's the scrub in, scrub out. That's what I tell teaching artists. When you enter the studio, you hand sanitize. When you leave, you scrub in, scrub out, just like doctors do.
Yeah, our policies, again, haven't had to be external, given that we lost the season, but internally, just people, you know, we close the office, but they need to come in to get certain things. And before it was, you were limiting how much time in between people coming in and what had to be cleaned or whatnot, to get to bring a cleaning crew in between every visit, as opposed to wiping down. So, you know, again, I think we look at local and national best practices, and you know, we're essentially sticking with the science. I would say similar to what Abby said, more often than not, we're going to pile more safety on top of the previous safety as opposed to removing any. You know, so there's certainly a belt and suspenders approach for now. We'll see how that evolves, but we're gonna err on the side of abundance of caution. Is probably, other than pivot, is probably the most used phrase in these past few months.
Now more than ever.
Yeah, that one too.
No, right.
More than ever.
Yeah, for sure.
Yeah.
Changed society forever.
Yeah.
The new normal.
The new normal, that's one too. Oh, we should make a shirt. These are all good.
I don't know if I want to wear it.
I do think that.
Yeah.
I do think this question from Jennifer is really worthwhile for us to all kind of take a look at, which is, how do you communicate and justify the same price for virtual versus in-person classes? And I think this applies to more than just classes. It is also for many of us, how are you running your gala? How are you doing performances? How are classes operating? everything, that difference between what is now virtual that used to be in person. How are you messaging the value that is still there to your guests and to your audience?
Yeah, go ahead, please.
Well, I think one of the main things that we were trying to remind people is that there's whether or not you're switching to virtual versus you're doing this in person, to keep this operation running so that you can get back to whatever is normal, so you can keep the people employed, so that you can make the investment in the community. In large part still cost. You know, it still has that cost. So especially when you're operating from a nonprofit standpoint, the truth of it is that you're operating at a pretty thin margin. So it's not like you're buying a bag of chips that has fewer chips in it, right? It's not that same analogy. We still have to keep these operations and these institutions open. You know, each of our institutions employ a number of people, and so long as we can continue to employ those people, those individuals are not a quote unquote burden on a system that is trying to support those that don't have that opportunity. So we all see ourselves, I believe, in some sense as a conduit for keeping people employed, keeping a community engaged, and whereas we're limited to a medium of virtual to some extent, it's not our top choice. It's not what we want to do. Even if you have a successful virtual season, I don't ever want to do that again. I don't. So I think that we try to remind people that cost is an investment in the individuals that make it happen, the institutions that make it happen, and the longevity of those institutions as well. While also being honest and owning that, look, I know that this is a different product. You know, we're never, you know, and I'm speaking a little bit out of my lane in that ours did not have a cost in the summer, but I think we all still face the same question that people will ask, what's the money for? It's so that it can be here.
Yeah, yeah, I have faced that as well. I love, you know, why are we paying for this? This is what I've explained to people from just a purely in the arts learning space. You know, it's very common that you go online and you like freaking Debbie Allen is teaching a tap class and it's free, right? It's Debbie Allen, okay? Like I stand Debbie Allen for my whole life, okay? It's free. Here's the thing, that class is going to be broadcast to millions of homes, right? And it is going to be an incredible experience. And it is not the same as a multi-meeting, you know, painting class that you're going to go through that is limited in scope, that there is, you know, there are outcomes that you are working to meet. There is a teaching artist that is planning and thinking about that. And so what I've explained both internally and externally is more times than I can count is like virtual experiences can only become less expensive when they are scalable past their expense, right? And so that's not our model. Our model is 10 kids, maybe less, in a Zoom room with a teaching artist who has, quite frankly, put in more time than he or she is used to putting in for an in-person, because they're having to wrap their brain around leveraging the virtual platform, right? There are very concrete and consumable materials costs, and it is an experience that is designed for those learners. It is customized in that it is only happening one time. It is not replicable, right? And it is a class. And so we have worked really diligently to specifically to answer the question. We have not gotten any pushback. We are offering many of our classes right now, either live stream or in person. It's the same class, and families and learners can opt in to which one works for them in their context. And the class is the class, right? We're still all of the same costs, to Kwofe's point. None of the costs change. The teaching artist for us, that's our primary driver of cost across the organization. The teaching artist is still sharing their expertise, their planning time, and their, you know, pedagogical experience with their learners. The medium is different. What's been remarkable for me to witness is the level to which our artists have continued to raise the bar and go above and beyond and create just phenomenal digital experiences for kids, way past, you know, the 2 or 3 hours of planning time that I'm able to compensate them for, because they're so committed to making the experiences memorable and impactful for kids. And I think that has been also helpful for families to see right away that this is a quality experience, and we're not just replicating what happens in person. We're doing it differently because the medium is different. And so that means there's additional design time, there's additional thinking time that goes into the experience. So it's a great question. It's a really great question.
Yeah, I'm scared. But it's funny, as a marketing person, I'm always like, this is going to be so hard to sell, but it seems like our community has been incredibly generous during this time. We had a gala that was scheduled for April, and we were very lucky that we had sold most of the tickets and the sponsorships, et cetera. And I would say 99.9% donated it to the institution. And then we did a virtual Fund the Need, which made probably 80% of what we usually make in the room, which kind of shocked me. I mean, it's been shocking and lovely. So we were able to end our fiscal year with a balanced budget, which, you know, it was really scary there for a minute. And now we usually have our Dada Ball and Bash, which is this like really iconic and fun event, and that would be coming up in the spring. And so we've started to wrap our heads around, what does that look like virtually? I've noticed a lot of institutions are doing free galas with, you know, sponsorship, et cetera, et cetera. And then I'll say we did our first trivia night. We had a virtual trivia night, and that was going to be our first.
So fun.
It was so fun. Oh my God. Again, like the marketing, I was a little skeptical. It's like, who wants to pay to be on Zoom on a Friday night? I mean, really, don't you all feel like completely zoomed out? But we did great. We had a capacity, we decided our capacity was 30 tables. I think we had 28, and, you know, it was fun. Me and my family and friends bought a table, and you could do like have people in your house, or you could do a digital. I'll say our development team really like rocked it, and they learned from Arch City Defenders. I think they learned from, there were other institutions that had done it, and then very generously shared all of their knowledge. So I don't know, it's given me a little bit of renewed hope, but it is still scary thinking about like, how do you bring in $300,000 for a virtual event? I don't know. Or maybe we just have to start innovating and thinking elsewhere, frankly.
I do think that's one of the things that has the potential to kind of be activated by us, especially as arts institutions. I think that, at least here, I'll speak at COCA, we have not tapped into, really, even in the virtual space, we have not tapped into family members, family, like the COCA family, community members, engagement outside of the region. And that, to me, is such a missed opportunity, right? Because when something's virtual, then it can happen anywhere. This summer, we had an experience with several folks who did our virtual summer camps, and they lived in other places. And so we shipped materials to them, and they logged on from their homes in California or Virginia or wherever. And it was awesome, but it was a very, very small part of the work. And so that, to me, is the next frontier, is how do we continue to elevate what's happening in our region in the art scene, which I think is very rich and very strong. And how do we share that across the country and across the world, because it is so easy to join in. As long as you have an internet connection, you're good, right? And I think that's where I want to see us move next, because I just think it's kind of the thing that, to me, we could do right now, and we haven't been able to necessarily do that before.
You know, and I agree fully that, like, looking at what the next generation or the next version of the virtual concept is, you know, I don't want to pass the opportunity to say, though, that it's tricky, because there are still all those people whose jobs in this industry are dependent on physical presence, that
Yes.
like whereas as companies we're solving the
Yes.
problem of serving our audiences and reaching our community virtually, there's that gap there that, you know, and we're all struggling with it. We're all conscious of it. These are our peers, our coworkers, our friends, our families. And, you know, and I don't have the answer, but, you know, when you have a forum like this and their ears and their eyes, it's important to say that there are, you know, as much as we're figuring out ways to survive and fulfill our mission from a community standpoint, it's a challenge. And you know, there are people, there's collateral damage out there that I think, you know, the philanthropic support that you see in this community is tremendous, right? You know, people have come to understand from a corporate standpoint, but how do you reach that group whose livelihoods are affected? Still a question out there.
Absolutely. Absolutely.
And that leads into Mary Claire put a question. How do you communicate with your donors, given that programming is so radically modified? How are you making that case?
You know, one thing I'll say that is we've gone really old fashioned, and we use that old house phone thing that people never, or even the cell phone that, you know, that maybe telemarketing was reaching a challenging point. It's not so much telemarketing, but I could speak for our development team. When we postponed the season, we had a good amount of season tickets out there, and we needed to see who would be willing to donate those or credit them forward to next year. And there was a virtual campaign, of course, through email and whatnot and paper, but to pick up the phone and call and hear from somebody was tremendous. We have a large subscription base, and we have a good sized development team, but the ratio is a lot. So even having random staff that aren't fundraisers, we're not fundraisers by trade necessarily, but we represent the institution, pick up the phone and call. I think that, and I'll be really honest, I think that was beneficial in both directions. When you've got a staff that's been home for a few months and you start to feel a little bit disengaged from the product and the facility and your coworkers, to be able to pick up the phone and speak positively or in an excited way, or from a place of true emotion about the place you love and work, is something that we forgot we don't get to do. We didn't get to walk in the hallway and love life, you know, for several months. So, you know, some of the old fashioned stuff of picking up the phone really made a difference.
Yeah.
It does seem like people are really valuing human connection right now.
Yeah, anything but a
Period.
Screen. Like anything.
Exactly. Totally. Phone over screen for sure.
We say from our Zoom room. So yeah.
Right. I mean, this is great.
It's efficient.
Yeah, except for this one. This one's really good.
This screen's good, just no other screens.
You know, I think that similar to what we said earlier, nobody has been untouched by the pandemic. And so I think I was just in a conversation yesterday with our director of development, and one of the things he was sharing was that some of our funders are calling us and checking and saying, how are you? And how does the work need to change this year? And what can we do to support you? And that is just remarkable, right? I really think for many years, I have wanted overall to strengthen our partnerships with our funders in a variety of ways, right? I do see them as partners, and I know that there are lots of ways that we can do better at that, and lots of ways that funders can do better at that. And I am truly hopeful that this experience globally is going to move the needle on that folks are going to be able to come to the table and think about community investments and investments in the arts in a different way than potentially has happened, you know, across the board up to this point. So far we have not had any major challenges in terms of anyone like being upset or something. I think people are excited to hear about the changes that are happening and the responsiveness that we're taking with our programming and our work. And like I said, I mean, I just truly, I still can't, I'm a little stunned. Like they called and were like, how are y'all? Like, how can we be helpful to you? There's nothing better than that. It's remarkable.
That is incredible. And
It really was.
It is 6:02. I'd like to be able to answer the last couple of questions that are kind of in the chat, if that's okay with all of you. So very quickly, Gwyneth asked, and this is specific to the Kranzberg safety guidelines, are they available for review? I will say that our guidelines are available on our website, but they are also available alongside the other 43 organizations that have been Missouri ArtSafe certified at MissouriArtSafe.org. So you'll be able to see what safety guidelines all of the different arts organizations across the state are using and be able to get ideas and help build your plan there. And next question is, and this is related to kind of, Abby, what you were talking about earlier. You're able to work with students that are in California and across the country and even the world. How are you differentiating yourselves from other arts organizations across the country that are offering virtual content to schools and organizations, but even just to regular guests that are tuning in?
I don't I don't think we necessarily are. I think the primary way that we've tried to communicate that is by offering kind of a variety of different paths of entry. So whether a family does things live stream, whether they're doing them completely virtually, whether they're doing them in person, whether they're doing them in a hybrid model, that has been something we've communicated. And then, like I said earlier, we also have the pre-recorded option, because what we knew was that asking families to commit to 15 weeks of anything during a pandemic is like a really terrible idea, right? And so having multiple options for folks so that they know that their investment, both of time and resources, is going to lead to something great, regardless of what happens, regardless of the circumstance, I think has been, we've tried to make that the leading story with our families. Our enrollment overall is down by about 30%, which is fairly strong, I would say, especially because our maximum enrollment in all of our studios is significantly lower than normal because of distancing. But again, it's really been about leading with, here are all the different ways that this can still happen for you, because we've just built the model in a worst case scenario mindset.
I think it, oh, go ahead.
Okay, really quickly. So we find that what we have in the artists that we present in our exhibitions, we already attract interest from all over the world, just in terms of the, the social, the website. Like, I will say contemporary art is somewhat niche. There is a somewhat slow global community, right? And so, yeah, I think we've definitely talked about the silver lining of, great, if we have virtual events, we could reach so many people. The reality is right now for CAM, we are getting, fewer virtual participants for our free public programs. I think we just have to figure it out still a little bit more, but it is kind of exciting in terms of, if you I really believe in CAM's artistic programming, and I think that there are opportunities there. And, it's exciting to be able to do an artist talk with somebody that's, in another country, right? So we are trying to lean into, okay, this sucks, but what are the benefits? Can we try to, capitalize on that a little bit?
What I was going to say is, beyond whether it's our education programs or the programming that we do, I think that we're all at a moment where we ask the question, it's less about what do we want to do or what do we want to present, and we ask the question of what do people need? What holes are out there? What do folks need, and do we have the capacity to fill that or not? And I think it's, the landscape's become far less competitive and more about making it feel more complete or cohesive. So, so that we're not trying to outdo the person down the street or around the corner. We're just trying to see where's there a hole and can we fill it, because the goal is to serve the public or serve the community. It makes it, now granted, there's a decrease in profitability from that approach, but that doesn't truly feel like the goal right now. I think the goal is about Is there an education program we could develop that fills a need for schools or school districts or kids? Is there something, you know, when we did our virtual season online, much of it was based on nostalgia, which was important for people in that time. So, yeah, I think that's it. To answer Liz's question directly, or the question before, I just don't know that you can do a whole lot of differentiating. You're just looking at what people need, and if you can plug that hole, then you do it.
Mm-hmm.
Thank you. And then Liz has a comment too that I think is really relevant just to share. Their development team at Metro Theater Company put on an amazing virtual gala. And I do recommend for all of you that are looking at doing virtual program, find those people that you want to support yourself, see what they're doing as you're going into your programming.
That's a great idea.
So with that said, I really wanted to thank everyone for joining us, and a tremendous thank you, Abby, Unity, and Kwofe, for taking the time to provide and share your experience and insights. Really appreciate it. We'll be providing a full transcript and recording of this webinar through email, and it'll also again be available at MissouriArtSafe.org. And we do ask that as you're leaving that you fill out the survey that will pop up and provide us some feedback on this webinar. We're getting ready to launch the next round of webinars, so we'd really appreciate any feedback. If you haven't already, visit MissouriArtSafe.org to see examples of plans and a list of who's already been certified. And thank you again for attending and working to make the arts able to create safely, present safely, and attend safely. Hope you all have a wonderful evening. And again, thank you.
Thank you.